Hi everybody, I'm Brianna and I'm here to talk about organizational and work role competencies found in Chapter 10, Domain number 7 of the Benner book. So the objectives of our presentation today are to explain the organizations and work role competencies by using personal and professional exemplars, explain the impact these domains have on nursing practice and interdisciplinary teamwork, and describe the competencies slash role slash impact in patient care and safety. So our first competency involves coordinating, ordering, and meeting multiple patient needs and requests, setting priorities. This competency was based off of completing interviews with pairs of new nurses and their preceptors. And they both found that organization was labeled as one of the major hurdles and changes in the new nurse's journey. And that compared to new nurses, expert nurses were able to prioritize tasks without losing information or missing significant needs of the patient. This took time and on-the-job learning to accomplish, so it wasn't something they expected new nurses to perfect right away. And they even mentioned the expert nurses and the newer nurses who were later into their journey mentioned stories about how they would respond to each request equally and with the same intensity. So one of the examples they provide is a patient needing a glass of water. Now, we all know that need is important and should be taken seriously, but when compared to pain medication or insulin, the medication needs to take priority over the water, and new nurses need to learn to set those boundaries. And the exemplar that Benner provides is this one from the point of a new nurse. She says, "If you saw me in the beginning, you would see me making 100 trips up and down the hall with a very frustrated look on my face, almost in tears and never really accomplishing much of anything. You would probably have to give me a lot of help. Now, I still have my moments. I mean, everybody does where they are still unorganized. But AM care is usually done by 10, and new medications are given right away. Charting is done earlier. Things run more smoothly. Now I feel more compassionate and more empathy for my patients." I think this is an important one for us as graduate nurses going into the field right away, understanding that this organization and priority making is going to take time and experience. The next competency involves building and maintaining therapeutic team to provide optimum care. So this competency is based on the foundation that each member of the healthcare team must share their opinion. Working as a team is crucial for the patient as well as team morale. Communication is an ongoing process, and differences of opinion are inevitable and necessary. One of the main exemplars Benner mentions is a nurse having a confrontation between a physician. A nurse describes the aftermath of a major confrontation between herself and a doctor after overgiving a patient shock therapy. "We really missed a valuable step, and that was getting doctors in writing policy with us. Even though it's not as strong, some people will say as rigid as I like, at least it's generally followed because it was passed by the psychiatric staff. What I think that it's real important is saying we're in this together even if we're disagreeing," which I think is an important takeaway for any member of the healthcare team, to understand that you're not always going to agree with everybody, and sometimes that is more beneficial because you are going to open up different discussions for what could be happening with your patient and ultimately give them a more well-rounded approach to their care. The next competency breaks down into 5 sub-competencies. The first, this involves coping with staff shortages and high turnover. So the first subcategory is contingency planning. And then it moves into anticipating and preventing periods of extreme work overload within a shift, using and maintaining team spirit, gaining social support from other nurses, maintaining a caring attitude towards patients even in the absence of close and frequent contact, and maintaining a flexible stance toward patients, technology, and bureaucracy. The main point of this competency is to show that nursing care is demanding and stressful under the best of circumstances, and intermittent shortage of nurses, high staff turnover, working with temporary or inexperienced staff, all cause work overload for the nurse. So the first one we go into is contingency planning. And in this competency, nurses mention that a constant process of triage occurs. Nurses must read the clinical situation, set priorities, and shift them frequently. And this is all weighed against routine standards, procedures, and guidelines that are being evaluated continually, constantly in this process. They did mention some standard priorities that stick out no matter what. Dangerous vital sign readings, medical surgical emergencies such as shock, high fevers, saturated dressings, IV medications running dry, and piggyback IV medications. All of those are standard priorities for nurses. But even high priorities get shifted during a patient crisis. So I believe this example is nurses' explanation of what happens during contingency planning. So the interviewer begins off with the question, so it becomes sort of, given the context and given the circumstances, how do you do as well as you do? How do you deliver an acceptable level of care? Nurse 1 says you need to do emergency nursing. Nurse 2, you need to find out what is most needed. Nurse 3 says you need to prioritize right at the beginning of your shift. And Nurse 4 says you must have a routine. You must have some sort of organization. And this goes into, Nurse 4 actually has a story she goes on with about how she had an emergency on her floor, and one of the hardest things she realized being short-staffed as a nurse was having to pull people from all over the floor, all over the unit, to get what they needed done. And once the emergency resolved and she had everybody where she needed them to be, one of the other nurses asked if she was behind the whole night, and she said no, but the only reason for that was because she had another nurse who knew what she was doing during the middle of that emergency. So if nurse number 4 would not have had that, she would have fallen behind. So I think it's an important thing for us, once again, as new grads, to remember that we need to prioritize not only for ourselves, but for other nurses on the unit in an event that an emergency happens with one of their patients, and we need to be the one to help either in the emergency or take care of patients while the nurse is preoccupied. The next one goes into using and maintaining team spirit, gathering social support from other nurses. Working with a high patient load requires support. And I love this quote from Benner. It says, "The sense of being under fire together generates a sense of camaraderie that cannot be duplicated under other circumstances." And Benner mentions an example of a patient had a blocked trach tube and there was no suction machine. Even more crucial, there were no tweezers. One thing that was really good was that the MICU nurses responded well and had sympathy, empathy, and they were willing to stop whatever they were doing to help out this new nurse, which I think is also an important role or thing we need to understand going into this field as new grad nurses, is that we are going to need help, and we should not be afraid to ask for it, and we should respect the nurses who do. I have asked numerous people in clinical for help, and they have asked me, and so I think we have a firm grasp on asking for help from people we know well, but I think it's something we need to understand, that we just need to be more open with coworkers that we're not quite as familiar with, and we need to gain support and be supportive. The next competency is maintaining a caring attitude towards patients, even in absence of close and frequent contact. Nurses with high patient ratios will not have time to have close personal contacts with patients, and the ratio is very unsettling, and I'm sure we all know that. A number of registered nurses on a team, and Benner specifically brings an example. Mind you, this book is from 2001. Of one RN having 20 to 40 patients and being the only RN on her team. Now, we don't see this in hospitals now, but this could be very well true of nursing homes. I'm sure we've all seen one nurse for either a whole floor or sometimes even a whole building of people. So I think that's important to remember. But at the same time, chronic patients allow for the nurse to get to know their patient and care personally for the outcome. This is also true of acute requiring a prolonged stay, and I have a personal example of this. During my 331 clinical, my group and I got to know a patient very well. She was there for weeks, almost the entire duration of our clinical, and everybody actually had the opportunity, or almost everybody had the opportunity to take care of her. So she was not discharged till the end of our clinical, and during it we would, during prep, stop in and say hi. During the next clinical, stop in and see how she was doing. It was very rewarding, and she really enjoyed the comfort, and I think we all were very excited and happy and showed the same level of intensity that she did when she finally was able to go home. The next exemplar goes into maintaining a flexible stance towards patients, technology, and bureaucracy. And this is understanding that goals must be attained in an imperfect world. A flexible stance allows nurses to accept idiosyncratic patient behavior, find technological substitutes in emergencies, and get around others' inflexible behavior. Bennersfield Notes brings an example of hospital policy prohibits drawing of blood, doing EKGs, administering skin tests, insertion of IVs by other nurses in a teaching hospital, and in tight situations, nurses have to work around these policies because they require immediate action. Which I'm sure we have all seen in the clinical setting in an emergency when a nurse asks a tech for help or somebody in the room who might not be as qualified, but it's the best they have. So next we can go into the significance of this to professional nursing practice. Organizational skills are key for nurses to gain authority and autonomy for their responsibilities. On-the-job learning is inevitable and should be embraced by new and expert nurses. Working in less than favorable conditions, such as short staffing, puts the nurse under stress, and these coping strategies or competencies are necessary for that. And that new nurses depend on experienced nurses for guidance, which I think this whole PowerPoint has a significance to nursing practice in that, especially as graduate nurses, we need to embrace on-the-job learning, and we need to know it's not going to come overnight, and we can use these competencies or these skills in order to build a foundation for us to eventually become the expert nurses and help the next generation coming in. The impact on interdisciplinary teamwork. Teamwork is essential to provide continuity and safe patient care. Members of a team must learn to work together despite disagreeing, as we mentioned earlier. And policy making does not always involve the necessary disciplines. And I'm sure we're going to run into this as new nurses. I'm positive. I'm sure a lot of us have even seen it in clinical, where we've had members of the healthcare team disagree, whether it be respiratory, nursing, physicians, surgery, whatever it may be. And we need to understand that that's important and vital to hear all these different inputs. But even if we are disgruntled with one of the specialties, we still need to come together as a team and work together in order to provide safe patient care. And this also gives us the opportunity to connect with other disciplines and understand what their role is in the team and how we can help make their job easier or better, or how we can contribute to it. So next is significance to patient care and safety. Earlier in the PowerPoint, the emergency nursing that was mentioned and the constant triage. There's a constant triage that goes on in my nursing, whether you are perfectly staffed or understaffed. You are constantly assessing your situation, and you are constantly reassessing and shifting your priorities. And that's important for patient care and safety because you need to be able to catch a problem quickly, and which can lead to minimizing injury and improving patient outcomes. If you are constantly triaging and constantly reassessing your situation, you are going to be able to catch discrepancies or issues, or even like the slightest vital change in order to improve your patient's outcome, or even catch something that nobody else seen. It's really, all of these competencies really go into the best care of the patient and safety for the best care for the patient based on the nurse's organizational skills. And this is my reference for the Benner book. I want to thank you all for listening, and I can't wait to hear what you say in the discussion.